Next on the agenda, I'll go to the 2024 county budget, which was proposed and put on the table on December 7th for the public to view or for any questions to be raised. And having been the required 20 days on display, today would be the day for formal approval or final approval of the budget. And again, this budget is proposed at a 0.5 mil increase from 3.8925 to 4.3925 for 2024. Total budget amount being $94,425,311. The only significant change to the budget since its initial adoption was the passage of the 911 fee of 30 cents from $1.65 to $1.95, which, as you all know, was passed by the legislature. That has resulted in an increase in funding for that, for the 911 operation of $245,000 for 2024. And that number is arrived by taking 85% of the 30-cent fee, which is what comes to counties. 15% of the fee goes to PIMA to fund special projects or cooperation among counties if they're maybe consolidating or sharing services. PIMA has an allocation that they can use as an incentive toward those types of projects. And also it begins in March of 2024. So it's 10 months of the year due to the billing cycle that even though it's been reauthorized, it takes January and February for the phone companies to give them time to get the billing cycle going. At this point, the again, $245,000 extra is less that the general fund has to put in for support of the 911 services. However, it's still approximately 3/4 of that. I'm sorry, 1/4 of that cost that the general fund is still funding. So, all in all, the budget leaves a surplus of $480,000 going into 2024, which, as I've characterized before, is about probably about a day and a half of operating costs for the county. So I think that's all. I'll answer any questions you might have on it. Maybe we didn't cover at the last meeting for it.
I'd like to discuss one more time, if I may, please, if you'll tolerate that, the bidding of PrimeCare at the jail. I thought about this an awful lot because we are so tight and we don't want to raise the taxes more than we have to. And we're very fortunate because we've had some good things happen. The opioid settlement is covering a lot of the people who have been addicted and are at the jail. They're getting treatment, is helping to get paid. MH Mental Health is helping to pay for treatment. And the WellSpan is, they get paid for Medicaid and Medicare patients, but there's some that aren't. I don't know the figure exactly that they're paying. That's going to come up, I guess, a little later. But so we're very fortunate to have those things going on. But while all that's going on and we're covering a lot of the care with those either dollars or donations, the PrimeCare went up 3%, and it's $3,537,682. That's about a quarter of the entire budget at the prison. And, personnel, to put that into perspective, personnel is 64% at $9,912,000. So I just think putting it out for bid will keep everybody's pencil sharp and will help us with our budget. And I'd really like to see that done. And so I'd like to make a motion to do, and we also have the other thing I thought of, we have a request for bid out, proposal out for cleaning the courthouse too. So there, that one's being done, but I don't think we should be resistant to doing that with other areas, especially when this is a quarter of our budget for the prison. So I again make a motion to bid the PrimeCare, or bid the medical that's going on at the prison.
Okay, we have a motion on the floor. Is there a second for that motion? Well, hearing none, Joel, I would respond to you. I said, for those of you who were not at the last prison board meeting, Commissioner Litz brought this up, and when we had a brief discussion then, I would reiterate, I would not be opposed to seeking bids. However, I think the first step is to establish an RFP, because what PrimeCare is doing for the county, long before I took this position, the county had significant exposure and was subject to a lawsuit and lost a lot of money because we did provide comprehensive services, and that's one of the key things that PrimeCare is doing. So before we accept bids, I would welcome the opportunity to discuss a thorough RFP to identify exactly what we need before we talk about going out to bid.
And I did hear you say that. I respect that, but there are examples of RFPs out there. We can contact our County Commissioners Association. They have some. PrimeCare might even have some with other counties, but there are RFPs that we would not have to start from scratch. So I don't think that that's a holdup for it. I really think that it could go forward with, developing the RFP.
I disagree that if you have an RFP to present, then I think that's where we should start.
But that's not my job. The job is to make the motion, pass it, and then have Jamie research and get us an RFP, and proceed from there. That, in my opinion. Yeah. So we have a difference of opinion. That's
okay. All right. Moving on. Or moving back to the budget discussion. Any additional discussion before we get a motion on the table?
No, those are the things. Again, I'm still trying to get the costs down so we, have no tax increase or less of a tax increase.
We're all in favor of that, possible. So anyway, is there a motion to approve the budget as presented on December 7th?
Also move.
I'll second.
A motion second. Any additional comments, questions? Hearing none. All in favor, please say aye.
Aye.
Aye. Any opposed?
Aye. Because I don't think we did everything we could. And it's not, Jamie and Angel did a fabulous job, but I still think we need to get these things out for bid to keep a handle on that budget.
Thank you very much. Do you have any additional items?
I guess if I may speak to that issue itself, there was discussion again, as you mentioned, Commissioner Kuhn, at last week's prison board meeting. Tom Weber, who you all know, CEO of PrimeCare, who graciously attends all of our prison board meetings, even as the CEO of a large company that has a lot of jails under contract. When we first contracted with them in 2019, I think we were just around $3 million, and at that time there were only two players in the industry. It was PrimeCare and Wexford. PrimeCare was chosen when it came time to renew that contract in 2022. We approached Mr. Weber and explained at that time the budget situation we were facing, which wasn't quite as dire as this year, but still tight. And they renewed for a 1% increase, even though the medical, the CPI for medical is typically around 7 or 8% per year. It's higher than the usual, than the consumer CPI. That was for 1 year. So for 2023, he came back and negotiated a 3% renewal. And that's what Commissioner Litz referred to. To me, those are reasonable renewals under the circumstances and in the environment. They also achieved for us during COVID an accreditation for correctional healthcare, a national accreditation for standards in correctional healthcare, which was remarkable to do that during a pandemic. So I think they did a stellar job of that. But the real issue, I believe, in going out for bid or for proposals on this is there are no other players. Wexford has since left the business of doing healthcare for county jails. And while there are plenty of hospitals and healthcare providers, correctional healthcare is a totally different industry. I mean, you've got to place personnel inside the jail. The mental health demands are steep. Typically inmates will come with healthcare issues to begin with. This isn't a criticism, but in general, it's just the nature of things that they aren't the healthiest individuals coming into intake because they have other issues in life, likely maybe drug abuse, alcoholism, those sorts of things that are presenting. So if we were to go out to bid, I don't know that we'd find anyone else interested in doing it, number one. Number two, those reasonable increases that PrimeCare have given us in the last 2 years may change. If you completely open the door to a totally new number, PrimeCare may come back and say, well, now we're going to give you a bid that is, in with the price index of medical care, and we may end up having a higher number than we already have now. If there's a way to insulate from that and say, we have the choice of renewing under the current contract, but if you're going to open up a whole new contract, then it's a whole new contract, and you may end up just with one bidder and one number, and no other choice. So, and that has happened. He shared a story where that has happened in another county that went out for bid and found no one else but his proposal.
Well, I'd like just a short rebuttal, please. And that is that when the contract was originally bid, we had more than 500 inmates. Mm-hmm. We have maintained an average of 260 to 270 inmates. So to me, it's like we're being charged double what we should for the number of inmates we have. And and I'm just making that comparison by the number of prisoners. We never got a break. And COVID shots had to be given. But that was part of it would have happened no matter what. Somebody could have come in from a drugstore and done it. But the point is, I still think that it's a hefty price to pay for 260 inmates. And that is one of the reasons I think we should encourage a bidding on this particular process.
Just one more comment to that. It's 260 is the average population. The number of inmates that go through the jail in a given year are multiples of that.
But
so
still,
you're dealing with when you're dealing with patients, it's I don't know the number. I don't have that on.
But we went from an average inmate population of over 500 down to 260 to 270.
Well, obviously, I follow the direction of the board. I would just caution you that
Understood.
There's not a lot of depth to the pool of providers out there, and that I believe that can be risky. Be careful what you ask for.
Jamie, maybe you could contact CCAP to ask if they have a sample RFP we can look at, just to explore that. Any other comments on that?
Okay. Laura, did you have your hand?
I just,
I thought you did.
Do you remember just how many bid initially when the county ended up selecting PrimeCare? You talk about the pool is whittled down.
I believe it was PrimeCare in Wexford.
Okay.
I'm gonna have to go back and check to make sure of that, but those are the names that stick in my head as the ones that were here.
And the other thing is, the contract isn't based, it's not a per capita contract that they're charging you for. It's a flat rate, whether you have 500 inmates or 260.
Correct.
Okay.
Right.
Jim, if you open that bid up to process, though, who's to say that you have to accept that bid? You still have
Well,
PrimeCare under the original bid. That wouldn't change.
Well, if the contract's expiring,
If it's expiring, but you wouldn't. I didn't know if Commissioner Litz is asking to open it up now, in the midst of it, and explore it, or what her intentions are. Because you could still say, okay, well, we're just going to reject it, and we'll stay with you at that.
PrimeCare could cancel their
rate.
current contract as well. I mean, they can cancel with notice. So I don't know, Jim. That's what I said. Maybe there's a way to insulate from, losing the current contract or anything like this. I don't know.